What other problems do we face?
Yeah.
Bipartisan, or if you want to move on to another series of questions.
Oh, yeah.
You just gave a good example. Any other examples?
For economic, or do you want to?
Just in general, bipartisan issues.
Okay.
Where
So
it's something that'll benefit everybody.
Okay. Here's one.
A bit of good news.
Yes. So my preferred topic to talk about, because it's not yet been affected by partisan labels. It's something that both sides give lip service to, but neither side really has done a heavy push in identifying, okay, this is the policy that we are pushing. And because they haven't done that yet, it doesn't have that, the toxic, Democratic versus Republican side to it. Mental health. I think that's one that, our society overall, we are becoming less and less healthy mentally. Just I think overall, it's a societal problem that I believe there's policies that could be implemented to help re-strengthen and reinvigorate our mental health, to get us back to what we had in the 90s before social media. I do ascribe social media to a lot of the ills that befall us. But I think that, when there's a mass shooting and people are quick to say, okay, yeah, it's a sign of our mental health problem. I agree. But then what are we doing to try to improve the public mental health? So I've been going around and I have put forth a couple ideas on what we could do in Lansing to improve it. They're maybe not good ideas. I don't know. I at least want to have the conversation. I definitely don't hear it coming from the Republican side, any sorts of proposals, because I would love it if they were like, oh no, your ideas are dumb. Here's our proposals and why they're better. Yeah, then that would give me something to bounce off of and compare to. But I from the Republican side, at least, I hear them, say we have a mental health problem. That's why school shootings are occurring and everything. But they don't actually identify a solution. My solutions that I've put forth are not necessarily great, but at least there's something to have as a comparison point. So one idea with our health insurance and the Affordable Care Act, we are our insurance providers are required to allow us to go get a physical checkup every year. We can go to the doctor, get a physical health screening, and it's no additional cost to you or I. Because we have health insurance, it's already included. No out-of-pocket expense. That breaks down the barriers where somebody like me, prior to that, I didn't go get an annual physical. Now I do, because it's easy, it's simple, and it's no reason not to. I get the benefit of it without the cost because it's already included in my health insurance. Likewise, if we just had a similar requirement for insurance providers to do the same for mental health check-ins, whether it's every other month or every month, the number each year is up for discussion, but just the concept alone of you have health insurance, you should be able to go talk to a mental health professional, and it's no out-of-pocket expense, no additional, barriers for you to do so, and you would be able to get that benefit just as you get the benefit from a physical checkup. Why not have that be something that is part of our system and make it where people are then more likely to go get it done and work to destigmatize meeting with a mental health professional? I think that that's just one idea that I would think would at least move us in the right direction. 20 years out, are we healthier as a society mentally? Yeah, if we had this in place for 20 years, I think we would overall. And just try to make it where going to the gym is very normal and destigmatized. You're working out, you're trying to get in good physical shape. Why not just, make it destigmatized and totally normal to go meet with a mental health professional just on occasion? Those are things that we would all benefit from. And I think it's something that in Lansing we could influence.
I agree that mental health is It's a problem, and I think it's getting worse over time. Two kind of thoughts / questions on it. From my personal opinion, I think there may be some issues of modern psychology in the way that it approaches the individual, kind of based off of Jung and Freud, where they viewed the individual as just an individual without, so to say, a spirit. Just more of it's like kind of like a robot. But that's a completely different conversation. But it does, I agree, and I like the idea of providing it for physicals. I think maybe we'll both look back on this and think this is pretty stupid. I think it's a good starting point. Perhaps like physicals, it will ultimately decrease health insurance costs because if you catch something early on,
right,
it's a good thing. I think there's a lot of stuff out there that could probably help people. Just even simple advice before it gets to be to where your situation's gotten a lot bigger than it needed to be. I think, but that one concept is a situation where maybe somebody, and I'm not saying this for mental health, just it pinged in my head. Throwing money at a problem makes the problem worse.
Okay.
Where, we've all seen different situations where if someone has a budget, you want to spend every dollar of that budget that year, even if you're spending it on something that's not good, so that you get the money next year. You always ask for more money. And I think that one of the issues that sometimes you're in a situation where adding money to the problem makes it worse.
Do you think that applies here with?
No, not necessarily. I just...
All right, because my perception, I would view the mental health demand or the need for mental health services as not being in balance with the mental health services being provided. I think that our society would benefit if more people sought mental health treatment. Would you agree with that perception of, if more people went, things would be better overall?
Yeah, I'm not disagreeing with you at all.
Okay.
On that. I'm just saying a completely separate train of thought. The idea of too much of money being spent on problems and it making the problem worse. I'm trying to think of an example that doesn't cross lines, because I wear a couple different hats. If it comes back to me, I'll bring it up.
Yes.
I'm not saying that spending money on mental health is a bad idea. That thought is not a very good one. People may think that I should go talk to them about mental health.
Well, and the whole reason I have this idea is because I'm a real estate agent, and my broker at the beginning of the year, he hired a life coach, and he said like all agents in our brokerage can meet with her up to 12 times throughout the year at no additional cost to us. And so I took him up on that offer. I started meeting with her, and Lisa Regato, she's a life coach rather than like a, as far as I know, I don't think she's licensed therapist or anything like that, but just I've never in my life sat down with somebody to just talk to them for those mental health benefits. Because, while she's a life coach, most of what her and I mean, my father passed away this year. So just assisting in having, those conversations about dealing with it and all that, it was such a benefit to me that I never would have been able to capture had I had the status quo maintained, where I needed to pay out of pocket and go seek it out on my own, and the opportunity wasn't just presented to me with like no hurdles to overcome whatsoever, just simply sign up on the calendar to go meet with her. That was such an easy way to start the process, and I found benefit from it that I believe strongly that if a similar opportunity was presented to everybody, that people would take advantage of it and they would see benefit from it, and overall our communities would be healthier for it.
It's a good starting idea. Some ideas sound good when you talk about them in practice. I think that's something that we see in a lot of areas where you have an idea and it's a good idea, and theoretically it should work out great, but in practice, call it greed or fraud without, around us. I mean, whenever there's a good idea, someone's looking to make money off of it.
Oh yeah.
We've seen that even the No Fault Act. It was designed to get people medical benefits quickly and reduce litigation. And you can't go to a courtroom. Well, can't go to a courtroom now, but beforehand, almost every single case had to do with it.
Right.
I mean, it's increased litigation, rampant fraud. Just an idea that should you find yourself in that position, just safeguard it.